Okay. Hello, my darlings, all my pregnant bellies out there. Lovely to talk to you and check in on you. This week we're covering the microbiome and helping your baby to create a really healthy immune system. And guess where that starts? That starts with us. So when babies are in utero, there's not a lot of microbes in the actual sac of waters. I think they've detected some, but the process of giving birth, so once they come out of that sac of waters and then come through the birth canal, there's something like 700 different species of microbes in a woman's vagina. I don't know about you, but when I heard that information, I was incredibly impressed with my vagina. I was like, oh my God, there's a universe in there. How cool is that? And I don't know if you don't know what microbes are, they're tiny little things. We can only see them through the microscope, but we have this symbiotic relationship with microbes where we need them and they need us. And, I mean, people who can get a little bit germ phobic need to kind of educate themselves about the microbiome because a lot of germs are actually good for us. And it's not the key with a microbiome is having a diversity of microbes. When we have diversity, then we don't get infections and yeast build up and things like that. Um, and so I always use the metaphor of like an old growth forest that hasn't been interrupted. Often, what you'll find is the way that the forest and the ecology within that forest operates is everything feeds everything else. So when things die, it then creates food for other things, and it's a beautiful sort of life cycle like that. And there's such a diversity of living, things within an old growth forest, and that's kind of a good metaphor for the microbiome. And so our microbiome in our gut is very important. And of course, what feeds that is our nutrition. It's lovely to see people becoming more and more aware around the importance of nutrition and to see food as medicine. Now, some foods agree with us, some foods don't. And what I've discovered, in my life, I've always been very, very healthy. And, weight and things like that have always been fairly consistent until I got older. And then once I was able to digest, I wasn't. So I tell you that because over a lifetime, foods that can be healthy for one person may not be healthy for another. And it's a really important thing that you build up good gut health and continue to eat whole foods. And by whole foods, I mean foods that you could recognize on a farm or in a garden or in a tree. Okay, things that we pick or plow or eat. And so your nutrition is very important. Now, the things that get in the way of our microbiome are excessive use of antibiotics. That's probably the number one thing. Antibiotics are wonderful if we're in danger of a major septic infection that could actually be fatal. There are certain things that can be very, very dangerous. And so we're very lucky to have antibiotics. The problem is if we overuse them, that and penicillin, if we overuse them, they tend to be less effective over time. And sometimes medicine tends to use these things as a way of just in case rather than dealing with real infection. So always remember if there's a choice around taking those types of medications, that you're doing it consciously and you're choosing to do it with understanding of the pros and cons of it. Always ask those questions. What are the risks? What are the benefits? Are there any alternatives? What else might I need if we do this? The other thing you have to appreciate is medicine doesn't have a great understanding around nutrition. In fact, doctors don't study it, which is really bizarre because food is one of the most important indicators of good health, the diets that we have. And there's been more scrutiny put over things like ultra processed foods and foods that have numbers and more than three ingredients and things like that are worth looking into. So you're going to start to get more conscious around this stuff now because when you've got little kids and you go to a birthday party and they give you cheesels and then you read the bag of what's in cheesels, you go, oh, I don't know if I want my kid to eat all that stuff. So it's good to get your head around that and Of course, that your microbial ecology is going to influence baby when they come through the birth canal. Now, there's what's called GBS testing. I spoke about this in the weekend just gone, but I don't talk about it in every class. It was one of the questions that came up. At 37 weeks, you get a test, which is a vaginal swab. And the problem with the test itself, it's looking for strep B. And strep B is a particular form of bacteria that can be quite nasty if you get an infection and if you don't treat the infection. Okay, for little ones, it can be fatal, but it's very, very rare, like really rare. And the problem is if it remains undetected, that's where the real issue comes. Now, coming up to that test, it's a great idea to get off sugar because sugar loves strep B and strep B loves sugar. So get off sugar, eat good, um, you know, like yogurts and things like that, which really support the microbiome. And yeah, do your best to get off sugar just for the mere fact that it just doesn't support your microbes and it also puts you on overdrive. It's a stimulant. Um, so if you do the test, the problem with the test is it can give you a false positive or a false negative because you might have active strep B one week and not the next and vice versa. So your carers, once they've done the test, and if you come back positive, there's going to be pressure to have antibiotics. So the option is not to do the test or to do it, but treat it as if it is positive. But the way that you can mitigate the risk is stay off sugar, have a good prenatal probiotic, and buy a thermometer for your baby. So the way that we know if baby's caught, because even if you have active strep B, it doesn't mean your baby gets an infection. But the way we detect it is the baby's increase in temperature. And then if it looks like they've got an infection, that's when you can treat it. So that's kind of how you can mitigate that risk. But always it's your choice. Whether you have the test, whether it really gives you anything conclusive or not is debatable. A lot of places don't do it now. We're still doing it here in Canberra. And in order to mitigate that risk, stay off sugar, keep a good healthy microbiome, and get a thermometer to keep an eye on baby, a couple of times a day for a few days after they're born, and get the midwife to show you how to test that. Okay, so that's good for you to know. Now, if you don't get your baby through your vagina, one of the most important things to help your baby develop a good microbiome is then skin to skin. Skin to skin on mum and skin to skin on dad or partner because your skin has a lot of different microbes and that can be really helpful too. You also could do a vaginal swab. Not all caregivers promote that type of approach, but putting a swab into your vagina and then pulling it out and patting it over the baby's face and body after they're born can be a good way of supporting that baby to develop their microbiome. Now, the next thing that helps good immunity is obviously breastfeeding. We often know that breastfeeding gives you antibodies, which are the resistances that you've built up in this world. You can then pass those antibodies on to baby, which is great. But there's something else about breast milk that a lot of people don't talk about, and that is the sugars in breast milk. I remember the scientists were examining the sugars and wondering why are they in breast milk because they're not palatable to the baby or something. I can't remember exactly. They were confused about these particular sugars, but what they realized is that the sugars are designed to feed the microbiome. So the proliferation of the microbes within the baby's gut, within the baby, on the baby's skin, in their nose, all the different places where the microbes are, get fed through the breast milk. So do your best to get the support you need for breastfeeding. And if you do need to go on to formula, you can express or get some donated breast milk. That's another option. And then formula after that. Now, if your baby hasn't had the most ideal start, because one of the things I really want you all to appreciate is that you don't this isn't about being perfect, okay? So maybe you end up with a cesarean, that's okay. Maybe you're not able to breastfeed, that's okay. A child's immunity builds up over years, okay? It's not like there's a window of opportunity and oh my God, they're screwed for life. Please don't take that need to get it right with you through this journey because there are things that happen. Child might end up with antibiotics, you might end up with antibiotics. That's not the end of the world. What gets missed there can be reclaimed further down the track. So, how does that happen? When you've got a little baby, your nutrition is good if you're breastfeeding, but even if you're not, that's good for your health. And then when they go on to solids, there's some really great resources I've heard mothers talking about. I wish I could remember the names of them. About a particular woman who's done a lot of work on helping babies to have good immunity. And she has, I don't know, recipe books and things like that. I mean, there's information out there everywhere, but having a consciousness around, when your baby starts solids. And then, of course, they'll start crawling and get them outside, get them in the bush, get them on sand, get them in mud, let them get out into nature because we know we get a lot of diverse microbes in nature. Pets are also great for little ones as well. And don't be overly clean, like, the antibacterial cleaning products and things like that. Um, I mean, they can be appropriate in certain parts of the house, but also remember that it's okay for, there to be a bit of dirt and stuff around for your children. Okay, now, another little thing I just want to remind you is that when baby's born, you're going to be offered Hep B, the vaccination Hep B at birth, as well as vitamin K. Let me start with vitamin K. Babies are born with very low levels of vitamin K. We're not sure why. Um, and I think that's an interesting question in itself. The idea is that vitamin K helps the baby's body to coagulate. So if they've had forceps and they've got a little bit of bruising or a hematoma on their heads, little things that can happen as a result of the birth, then vitamin K might be really appropriate. They typically do it via injection, but there is a second option, which is orally over 3 doses. And that's a bit of a gentler way to give the baby vitamin K. And then what we know is that vitamin K builds up in their system through breastfeeding. So it's always a bit of a mystery as to why they do have low levels, and maybe there's a reason for that. We don't know. But it is standard procedure to have vitamin K. So if you look into it and you don't want to have it, make sure you've put it on your birth map and let them know, because otherwise what typically will happen is they'll come in and they'll grab your baby and they'll check hips and hearing and poke and prod and vaccinate and do all these things and then hand you a screaming baby. No. Anything they do, they can do on you, except maybe check their hips, and that's fine. Um, but just make sure it's very clear to your carers what you're saying yes to and what you're saying no to. Now, the other one is the vaccination of the Hep B. Hep B is a sexually transmitted disease. If you are not carriers of Hep B as parents, then the risk of your child getting, well, it's virtually no risk, unless you live in a drug den or you've got bloody needles around or something like that. But even then, a newborn baby's not likely to get Hep B, okay? Um, it's been a little bit contentious, the old Hep B. It's stopped being offered, I think, in Europe. America tried to get rid of it recently because the evidence and the risk didn't kind of weigh up. So it has been one of those vaccinations that's been questioned. They then offer it again, I think, at 2 months. You'll have to have a look at the vaccination schedule, but remember, it's a choice. So look into it. If you're happy to go ahead, let them know. If you're not, let them know. Make sure nobody does anything to your baby that you're not aware of. Okay. Now, the vaccination schedule is a lot. It's quite a lot actually. And I do know that there's some rumblings going on around, is it too many? And I think I read recently that there's, because I keep abreast of this, this is something I've had a bit of interest in, particularly since COVID, and what we saw playing out there, but also when I watched the vaccination schedule from when I had my first son to when I was getting ready to vaccinate my fourth, it got very, very crowded in that period of time. And so now there's a little bit of questioning going on. Is this too much? It's good to sort of explore this a little bit. We tend to think things like vaccinations are without risk, but that's not actually the case. A lot of the adjuncts and the things within them are things like aluminium, which is what's used to trigger an immune response. So that's part of the actual mechanism of creating antibodies. But the accumulation of some of the substances is being questioned. So just because it's a schedule doesn't mean you have to stick to it to the T. You can spread it out. You can perhaps do individual ones. You can say yes to some and no to others. Although that certainly isn't promoted. The vaccination schedule as it is promoted as a this is what we do. But always, always think about what you're doing and why you're doing it and what are the risks and benefits associated with it, okay? I'm not anti-vax, so if you're sitting here listening to that going, oh my God, she's one of those. No, darlings, don't put me in a box. That's an excuse not to think, okay? I'm just getting you to think about what you're doing and why you're doing it, weighing up the risks and benefits and recognizing that medicine is always a work in progress. And what was considered safe 20 years ago and what is considered safe now is always changing and it's always being reviewed. Science is a work in progress. Always remember that. And the other thing with vaccinations, too, particularly further down the track, if your child is sick, don't do them, even if they're due for them. Just delay it because you don't want to overload the immune system. Okay. Sometimes we do these things very mindlessly and then we put the babies under their immune systems under a lot of stress. So get a little bit conscious, work out when you're going to do them, how you want to do it, or even if you want to do it. These are all choices that you make as parents. Okay, that is my list. So I hope that's been useful. Um, this is an important topic because our children's health is very important. And what we do know is children are actually getting sicker. I think the toxicity of our environment and the overuse of antibiotics, food, potentially vaccinations, all these things can be influencing the overall health of our children. And I do know that this is an area that's worth exploring and will be explored over time. And you're in a moment in time. So do your best to inform, be conscious, choose what you want, what you don't want. And good luck, darlings. I'm here for you whenever you need. Thanks for listening. Ciao.